All right, so continuing where we left off in part 1 video, this is continuing with dissociative anesthetics, and here's that mixture I've been telling you guys about, ketamine and diazepam together in combination. There are a lot of advantages, and there are just a couple disadvantages, but let's run through the list real quick. Minimal cardiac depression, good muscle relaxation, and superior recovery. And with ketamine, we have some analgesic effects. Those are all great advantages. Disadvantages, possible respiratory depression is greater in the combination. So I told you about that apneistic breathing pattern in the last video. That can absolutely be worsened whenever we mix these drugs. It does not work, it should say, well, IM in dogs and cats, and in fact we never, ever, ever give ketamine and Valium or ketamine and diazepam together IM. It's not something that we'll ever do. But there is an option, midazolam, which is another benzodiazepam. Once again, go back and look at the benzodiazepam video. Is well absorbed and can be used in place of diazepam for that IM injection instead. Taletamine, remember taletamine is in the mixture called tilazol, and it has very, very similar properties to ketamine. Okay, so it's very, very similar. It's only sold one way, and that's in combination with zolpidem, which is another benzodiazepam, and it's marketed as the drug called tilazol. One of the really important things to remember about this drug is it's sold as a powder, and we reconstitute it, i.e. mix it with sterile water, usually 5 mL per bottle, and then it goes into its liquid form. It is stable for 4 days at room temperature and 14 days if refrigerated, so it has to be used relatively quickly, and for the most part that's what we do. It is again a class 3 controlled substance, so the DEA does keep a good eye on this drug, and it can be used in combination with other tranquilizers, or it can even be given as a adjunct with ketamine, which is strange because taletamine is like ketamine, but you can actually give them together without many ill effects. Dissociative anesthetic advantages of tilazol. Big thing with tilazol compared to ketamine and Valium is we have that decrease in the apneistic respiratory response. Remember that apneistic respiratory response is an animal that holds its breath at inspiration and holds it for a period of time like they've forgotten to breathe. So we have a decrease in that with tilazol. It can be administered IM, IV, or sub-Q, which definitely gives it an advantage over ketamine and Valium, which can only be given IV. It's currently only approved IM in dogs and cats, so generally speaking, that's the only drug that it's approved for. That being said, like many, many, many drugs in medicine and veterinary medicine in general, it can be used off-label, and essentially off-label, it can be used in other species even though it's not labeled or approved for that species. And because of that, they use it a lot in wildlife. Disadvantages for this drug, the big thing is a lot of times they can have long and sometimes difficult recoveries. For the most part, if the animal is pre-sedated with a good analgesic and sedative before tilazol was given, then we usually don't see those difficult recoveries. If given alone, though, you can see that. It's metabolized in the liver and excreted in the kidneys, so we do worry about kidney and liver function before these drugs are given. These animals will have ataxic symptoms. Remember, ataxia is kind of like a stumbling or inability to stand. Think of the drunk person coming out of the bar again. Increased sensitivity to the stimuli in recovery. This is another one where a lot of times if the animal has that increased sensitivity, it's a good one that you can turn off the lights in the kennel or close the doors in the kennel so it's nice and quiet for them, and that usually eases their recovery if that's possible to do. And we avoid this in any patient that has a physical status of P3 or greater. Remember, P1 and P2 are usually low-grade, minimal anesthetic risks. As you get into P3, now we're getting into anesthetic risks, and this drug will be avoided in those ones. It can cause central nervous signs on occasion, hyperthyroidism, cardiac disease, pancreatic or renal disease, pregnancy, glaucoma, and penetrating eye injuries are all reasons why the doctor is not going to choose this medication. Guafenicin is one that's used in large animals. It is a non-controlled muscle relaxant. It has very good muscle relaxation properties. It can facilitate intubation in those large animals, horses and things like that. It eases induction and recovery. Usually the animal goes down slowly and recovers slowly also. Gives us time, gives the animal time to wake up fully before they're trying to get up on their feet again. It is not an anesthetic or analgesic. Which goes to say that it's not an anesthetic or analgesic in the traditional terms of an anesthetic or analgesic. It does obviously produce a dissociative anesthetic effect. So the main thing is it can be used in other ways other than an anesthetic, so it's not quite in that category, and it does not take care of pain, which is really, really important. There is no pain relief when it comes to guafenicin. And its mode of action is not really understood. They don't know exactly how it does its job. When it comes to guafenicin, there are very minimal effects on the cardiovascular and respiratory systems. It provides very good skeletal muscle relaxation and has a minimal effect on the diaphragm. Remember, the diaphragm is the muscle in between the abdominal cavity and the thoracic cavity, and so we usually don't see many respiratory effects on this drug because of that. Guafenicin can be irritating to the tissues, so it really has to be you have to make sure that this drug goes IV. If it goes and seeps outside of the vein at the site of injection, we can have perivascular tissue irritation, which essentially means around the injection site, the tissue will become very inflamed, red, swollen, things like that. And it has been linked to hemolysis, which is destruction of blood cells in ruminants and horses, only in high concentrations though, so that's really our main concern. A lot of times it's used with ketamine as an anesthetic induction protocol. Usually these animals are pre-medicated with either an alpha-2 agonist or a drug called acepromazine, which we talked about in sedatives. It can also be used as a triple drip. Triple drip is essentially they're mixing a couple different drugs, so it can be mixed with ketamine and xylazine, and this will maintain anesthesia for less than an hour. So essentially the drug drips in slowly into an intravenous port into the animal's veins, and mainly horses, and will produce and maintain anesthesia for around an hour is the maximum time that this should be done. It can be administered IV rapidly until the animal is ataxic. Remember, ataxia is stumbling, right? It can follow this pre-medication, so we pre-medicate with another drug and then give this IV rapidly. When the animal is ataxic, they can be completely induced into an anesthetic state at that point in time, and generally speaking, there is a very smooth recovery whenever it comes to this drug, which is one of the reasons why equine doctors, it's one of their favorites. Part of an anesthetic induction protocol in combination with ketamine is the other way that it's used. You must pre-medicate. If we do not use pre-medications like opiates ahead of time or a good tranquilizer, it may cause excitement. and the increased of risk of side effects if there's no pre-medication. So those side effects that this drug has been linked to will become more apparent without the pre-medication. It's never used as a sole agent. It's only ever used in conjunction with other drugs. The sedation and analgesia by itself would be very inadequate for surgery. All right, that concludes our conversations on dissociatives. This is part 2 of dissociative.